Well, Tiffany, if you've recently had to make a trip to the emergency room or even tried to just make an appointment with a local doctor, you've probably experienced longer than average wait times. Well, some of this is, yes, in part due to the pandemic. Tonight, ABC6 News spoke with local nurses and doctors who say that's not the only cause of both a staffing and blood shortage striking New England.
Overcrowded hospitals, burnt out staff, and a shortage of blood are becoming a growing cause for concern in New England hospitals.
Nurses are constantly afraid for the safety of their patients and for the safety of their own licenses.
Kornakia says while the pandemic has been a contributing factor, that's not all there is to blame.
Even before the pandemic, we have been experiencing a lot of burnout, PTSD, because hospitals have taken the route of profits over patients.
When a surge hits, the impact can be overwhelming.
Since the last surge, we've had an influx of patients like we've never seen before, and it's not necessarily COVID related. And I don't know if you've tried to make a doctor's appointment recently, but you have to wait months for services, which just serves to complicate pre-existing situations. So our hospitals, our emergency rooms especially, are overburdened.
A recent study conducted by the RN Work Project over a 10-year period revealed 17.5% of nurses left their position within a year.
Staffing problems that we see pretty much everywhere, and especially in the healthcare sector, is definitely affecting the hospital, certainly at Rhode Island Hospital and Hasbro Children's Hospital.
On top of the lack of staff, Dr. Luck says there is also a near critical shortage of blood.
The big fear is some major need for a massive transfusion.
According to the Rhode Island Blood Center, 30% of donors who book appointments do not show up, in part due to fear over new variants.
It is completely safe. I mean, it's never been safer than now.
The Rhode Island Blood Bank did say some of those cancellations to donate blood were attributed to reasons such as fears over the new COVID variants and confusion over if you have to be vaccinated or not to donate. Tonight, they did confirm that you do not have to be vaccinated to give blood, but safety protocols to do so are still in place. Live in the newsroom, Emmeline Reed, ABC6.